So Alan is the editor-in-chief of Health Affairs, which is the nation's leading health policy journal. But beyond that, you all know his credentials. You know he's eminently qualified. Part of creating a movement is getting to know people beyond their credentials, beyond the face value of what you see. So I asked Alan a few questions about that kind of give you a little more insight into the man. So I asked him what was his favorite live concert he ever attended. And he said in 1976, July 4th, 1976, at the country's bicentennial, he saw Peter Frampton. Quite memorable. I asked him what his guilty pleasure was. Now, you know, I'm wanting something salacious. What do I get? He does word and number puzzles. And then I asked him, you know, what's the one word you want to come to mind when people hear your name? And this is the one he didn't have to think about. He said challenging in every sense of the word. So I give you the challenging Alan Weil to lead us through the rest of the morning. Thank you.
Thank you, Karen. It's great to be here. I always love being at the Colorado Health Symposium. I was one of those who stood up and stayed standing up past the 7 count. In fact, as I was looking for something on my computer this morning, I found my PowerPoint slides from the 1999 Colorado Health Symposium. I do like coming here better when I don't get a 5-hour delay and show up at 1 in the morning. You're getting my voice from just a few hours of sleep, but hopefully that won't get too much in the way of the presentation this morning. There are many reasons I like coming to the symposium aside from returning to Colorado where I lived so many years. But one of the things I like most is that there is every year a theme, and I challenge myself, and thus the word challenging, and I am challenged by the staff to think about the theme and what contribution I might be able to make. And since this year I'm kicking off, I grappled with the theme, health is everyone's business, and I have to start with a bit of a confession. I didn't much like the theme when I got it. And I thought, you know, I like coming to this symposium. If I come and spend half an hour telling you why I don't think it's so great, I might not get invited back next year. So I challenged myself to turn this into something that I could work with and hopefully help you think expansively about the topic, and that's what I'm going to try to do this morning. So in order to do that, I tried to break it down into a few components and think about some of the implications. So I just begin with, if health is everyone's business, we have to start with understanding what health is. And I tend to prefer the WHO definition, a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. And what's great about the definition is that it immediately pulls us out of medical care as the primary or certainly the sole driver of health, and immediately makes it easy to imagine that health is everyone's business, because this is a goal certainly we would all share, and it is multifaceted, multidimensional. And it's a good, for me, organizing theme for understanding how to approach the goal of having health as everyone's business. Then I looked at the phrase and I thought, well, there's another phrase you can see I do word puzzles. Right? This is, health is business. And I think in order to think about something being everyone's business, we have to grapple with health as a business. After all, I don't need to tell you, but we do publish every year the health spending projections and historical review created by the actuaries at HHS, and we've crossed the $3 trillion mark. Health is a huge business. It's a sixth of the economy, and this spending is scattered around so many different services, so many different settings, so many different people, that we have to understand that if we're going to take a business approach and think about something being everyone's business, it's a business, it's a set of businesses. And along with being a business come many aspects of health that might not be the ones people think of as they're thinking about the World Health Organization definition with this very broad sense. So I just thought, well, what are some of the implications of health being such a big business? Well, yesterday I stumbled on this headline in the New York Times. You know, U.S. says Florida network defrauded Medicare and Medicaid of over $1 billion. This boggles my mind. I don't, you know, I worked here in Medicaid and fraud has always been an issue, but $1 billion, think about how much money that is. $1 billion taken out of taxpayers' wallets for fraudulent services. This is just one network. It's, assuming the claims are true, it's a huge takedown, it's a big deal, but the scale of the opportunities for misuse of resources when you're talking about $3 trillion is huge. Think about what you could do, what we could do, that would actually promote health with that $1 billion. And when health is a business, we get hearings with people like Mr. Shkreli, who I didn't really follow because it just feels like another story, another day. But it's not just fraud. There are tremendous opportunities legally to take advantage of the business functioning, the business model within healthcare. In his instance, changing prices, modifying prices in a way that maximizes profits, which is exactly what he was trying to do perfectly legally. And that takes money out of the other places we might want to put it to promote health. This is what happens when health is a business. But it's not just bad people, it's not just fraud. This comes out of a paper we just recently published analyzing the 10 United States hospitals with the highest levels of profit from patient care services. And a few things stand out, aside from the fact that there is one Colorado hospital on this list. And I don't want to go too deep into who is and isn't on the list, but it's noticeable that the majority of the hospitals that have the highest margins are nonprofit. So this isn't just about profiteering. This is about building institutions and growing them and maximizing revenue and doing what you can do to succeed in this market that we function in. And I don't mean to pick on hospitals. This chart comes out of a paper just in the last issue by Sherry Gleed now at NYU. She was trying to decompose where do these $3 trillion go? And what's striking is that every sector, not surprisingly, within healthcare, she pulls out hospitals, physicians, outpatients, they're all looking at their expenses and building margin on top. That's what you can see. And at the top wedge is the overall sector revenue above operating expenses. We are a high margin sector. We're producing value for those who run the sector, whether they're for profit or not. And those dollars, of course, are coming from some other place, whether it's public or private resources. We are a big business. Health is a business. And when you're a big business, you also get lobbyists. Not to pick on pharmaceuticals, because there's a chart like this for every sector in healthcare. In excess of $150 million spent on lobbying right at the height of some of the big policy decisions. But there's spikes whenever we talk health policy. And as I say, similar charts for hospitals, for physicians, for anyone else in the system. We've created this ecosystem where there's so much at stake that it's important to have a lobbying force. And what are these organizations and sectors lobbying for? Well, this is a recent public policy example. Again, I could use so many different ones. CMS is looking to change how they pay for drugs in Part B. So these are high-cost drugs, not the pills you get at the pharmacy. A lot of these are cancer drugs, infused drugs, often $1,000 plus. And they're trying, or they've proposed to try something that it would take a while to explain, but the bottom line is right now for these drugs, if you're a physician and you administer them, you get paid a percentage of the cost of the drug to keep, as you will, as the cost of administration. So the more expensive drug you infuse, the more revenue you get. And a lot of practices, their entire business model is based on capturing that. And so what CMS is thinking is, there are a lot of instances where it might be better to use a cheaper drug, but the incentives are such that oncologists don't want to do that, and so we're going to change the formula so that you don't get paid so much more if you prescribe a more expensive drug. And what happens? The sky is falling. Everyone's going to lose access to care. What's happening is, because there's so much money, and again, I don't want to pick on this example because there's so many, with so much money, with so much business at stake, everyone builds their revenue model around what is, and once they've done that, any threat to what is a threat to their business model. And so there's strong opposition to almost any kind of change simply because it threatens the revenue streams of large and complex and well-resourced institutions. And they complain, and they're very good because what they always do is that they're, of course, doing it to protect the patients. We don't want to get in the way of patient access. We don't want to limit patient choice. It's never the language of revenue or business model. It's always the patient is invoked, whether true or not. So I guess it's, for me, as I think about embracing the theme that health is everyone's business, we have to start by understanding that health is, in the United States, a business, and anything we want to do to change it has to acknowledge that. Which leads me to another little word play, which is that what I can embrace without any difficulty is that the business of health is everyone's business, because if we don't attend to the business of health, then it affects everyone. And these are all charts you've seen before, so I'm going to go through them very quickly. Health as a share of GDP is growing, as I mentioned. We just 2 weeks ago published the projections. By 2025, it's $1 out of every $5 in the US economy. We've just passed $10,000 per capita in spending in the United States. So this affects everyone. The business of health is everyone's business. It affects the federal budget, as we see our ability to spend on things other than health declining as the major healthcare programs, that sort of light, medium blue line, is growing and growing. This is projections out to 2045. You feel it at the state level. As states increase their spending on health programs, they have less ability to spend on everything else. And of course, this affects families, it affects businesses, it affects everyone. So if we're serious about doing anything, we have to take on and look at the reality that health is a business, and the business of health is everyone's business. So that's not a very, I know that's not what you meant. It's not what you meant, but it's where I took it. So now, since I did my PowerPoint slides, now I want to try to talk about it a little bit more, I think, the way you at the foundation meant it, because, as I say, I want to get invited back next year. Okay, so I think I can do this without standing behind the podium, but I may have to come back a few times. But I'm gonna pretend I'm actually able to talk without standing behind a podium, and we'll see how it goes, because I don't normally do this. Okay, so health is everyone's business, and that's great. It really is. If we want health the way the World Health Organization defines it, we need everyone involved. There's a problem. The problem is Google. I Googled ... is everyone's business. And I learned that education is everyone's business. And I learned that protecting children is everyone's business. And that social media is everyone's business, yours included. I learned that disability rights is everyone's business, and the environment is everyone's business. So let's take the last one. The environment is everyone's business. And this is how well we're doing on the environment. And you know how well we're doing in education. You know how we're doing in everything else. My concern about the health is everyone's business name is that if everything is everyone's business, nothing is anyone's business. And that worries me. If you want a movement, if you want action, you can't make it easy to shift responsibility to everyone else and have everyone think the problem's so big we're never going to be able to solve it and walk away from it, which I'm afraid is what often happens when we say that something is everyone's business. I told you I couldn't do this. I got to look at my notes. Okay. So if I was out of time, I would just be leaving you with a downer, but I don't want to leave you with a downer. So what I want to do is embrace what is meant by health is everyone's business and try to turn it into a positive, because I do think it is one, but it takes some work. I think there are three things we have to do if we want to make health is everyone's business more than a slogan. The first thing we have to do is we have to share the agenda. Now, the reason I went on my computer this morning is I'm recycling one slide from last year. I'm sorry. I put this up last year. I thought of this a long time ago. It's got my name on it. I have to use it every chance I get. So my postulate is that population health is more than the sum from 1 to infinity of accountable care organizations. And what I'm trying to get at is, you don't get population health by giving a bunch of health systems responsibility for the cost and outcomes of a bunch of people. That's not population health. So this doesn't fit in a tweet, but I want to say this as clearly as possible for someone who's had 3 hours of sleep. What health systems are doing today to try to take accountability for patient health, what they call population health, the health of their patients they serve, and the cost of doing that. The vast majority of what they are doing is moving slightly upstream to try to address personal barriers. This was better when I'm awake. What they're doing is trying to address individual barriers and tackle the immediate upstream barriers or causes of healthcare costs. So if you don't want someone to return to the hospital when they're discharged, you go to their home and make sure that they're taking their medications correctly. If you are looking at your high-cost, high-need populations, you're trying to figure out what social support do they have? Do they have enough food? You're addressing, because you know that if something goes wrong for that, it is going to yield a demand for a healthcare service that you as a provider or an accountable care organization will be held financially accountable for. Okay, tweet that. Go, I challenge you. That's what health systems are doing. So this is great. I say this every chance I get, I would much rather have a hospital do something to prevent a readmission than do nothing to prevent a readmission. But what they're doing is not population health. So I worked in social services a long time before I worked in health. And I studied social services. I never thought I was going to go into health. And here's what I can tell you. I know this comes as a great surprise when I talk to health audiences. There are people who've been trying to address social problems for a really long time. They know a lot more about it than most people in healthcare. They know about housing, they know about food, they know about education, they know about poverty, they know about racism, they know about changing systems, and they don't do it one person at a time. There are lots of one person at a time interventions, but they're looking for systemic change. Talk to people who are trying to address poverty. They're thinking about how do you change systems, transportation, education, all of those. These are systems. So if we want health to be everyone's business, those of us in health have to embrace the agenda. The agenda is not, I'm going to get food in the refrigerator of my patient. The agenda is, we're going to reduce the number of people in Colorado who are suffering from food insecurity. That we're not just going to try to make people health literate so that they are better consumers of healthcare services. We're going to try to improve the overall education system so that people are more empowered in all aspects of their lives, not just in healthcare, and can get better jobs and can advocate for themselves and for their communities and for their families. You get my point. I don't need to belabor it. If we want other people to embrace our agenda, we can't just embrace their services. We have to embrace their agenda as well. So this is not something that I think is happening in healthcare very much these days. I think we talk a lot about the need to address the social determinants of health, but we don't talk about the true roots of the social context that creates the disease burden that exists in our communities, our states, and our countries. And that's what people who work in social services and the social sector do. They're looking at the system. So if we want other sectors to be part of our movement, we need to understand them not as service providers, but as having their own agenda for their own movement that is not just in service of reducing healthcare costs. So that's the first thing I think we have to do. The second thing we have to do, I appreciate it, thank you. The second thing we have to do to make health is everyone's business more than a slogan is share the power. Now, what do I mean by this? So this morning I went on the internet and I found two pictures. So on the left is a beautiful new hospital built, I blacked out whose health system it is. You see that little black line? That's so you don't know. And on the right is a picture I found at random, I hope it's not copyrighted because I just used it, of a waiting room of a social services office. So when I say share the power, this is what I mean. I see all around the country highly resourced health systems reaching out to the social services sector, saying, we need you. You're in the community. We're trying to identify people at high risk. We need your help so that we can spend less on healthcare and keep the profits, of course, because that's how we're getting paid. And so please come to our beautiful new building and come to our office and meet with our lawyers and meet with our IT team and sit in our beautiful marble lounges and tell us what you can do for us before you go back to the borrowed desks that you have in your basement offices where you're paying, the lowest class rents, because your revenue stream doesn't look anything like my revenue stream. And I'm not really going to invest in your long-term success. I just need you. I need you now. And I don't think that's a platform for convincing other people to embrace our agenda that health is your business. So the fact is, what we think we need to improve health is based in places that have nowhere near the resources that we have in the healthcare sector. And if we want them to be part of solving our problem, we have to share with them the power that we've accumulated over decades of developing revenue streams and beautiful results for very sick people and things that are truly wonderful. I don't want to suggest otherwise, but it has created an imbalance in the power between those who are in the health sector and those who are doing things that improve health, who are barely scraping by, whose salaries are a fifth of what they typically are in the health sector, depending on the position. And if we are serious about having everyone embrace our vision of health, we need to be serious about sharing the power. And then there's one more thing. So you've seen these headlines. You know, we waste $750 billion a year. We're plagued by waste. We hear this so often, I think in healthcare we tend to forget, or we're kind of numb to it. So here's a nice donut chart. A pie with the middle eaten out of it. It's a donut chart from the Institute of Medicine. We, in the healthcare sector, have to take this seriously. It's not just the $1 billion of fraud that I showed you the picture of. Where are we wasting money? The largest section, a quarter of $750 billion. Unnecessary services, services that provide no clinical value. Inefficient, I'll go across the other side of the donut, 25% in green. Excess administrative costs, a quarter of $750 billion. I spent an hour on the phone yesterday morning trying to sort out a denied dental claim for one of my daughters. Somehow, somewhere in the middle of an electronic data transmission, the date of service was changed by a year, so the claim was stale and they didn't pay it. An hour to figure out how to get a $150 dental visit paid. That's just what it is, right? But we take that as a given. Inefficient delivery, waste, high prices, fraud, lost opportunities at prevention. We're filled with this stuff. That's what the sector is that we've built. And we want everyone else to embrace our agenda. What about cleaning our own house? What about liberating resources and time for those who are trying to improve by doing our own work and leading by the example of our own improvement, rather than saying, we need your help, but we're going to ignore this. And just so you don't think I'm picking favorites, you know, the excess spending, this is a McKinsey Global analysis, runs through all of the sectors. So they look at outpatient care, inpatient, drugs, administration, insurance. The waste is marbled through the system. It doesn't just sit in one place. And it leads to charts like this that you've seen, Betsy Bradley's work, I hope you have seen. We are an outlier in the OECD. We spend a lot more on health. We spend a lot less on social services. The totals aren't as different as you might imagine, given how expensive our health sector is. But if we believe that improving people's social context will improve health, we have to believe that there's something wrong with this picture. And we just, a couple of months ago, published an analysis that she and colleagues did looking at state-level data. And there are a lot of methodological challenges doing it, but the conclusion of the work was that states that have done a better job of balancing the dollars towards social services tend to have, controlling for all sorts of variables, better health outcomes in a number of areas. So it's not as if we don't know this stuff. It's just that we live with the system we have, and then we ask others to change it. So let me just close by telling you that now that I'm the editor of Health Affairs, I have access to the archives. And every once in a while I go scratching through the basement looking for things that maybe didn't really get as much attention as they should have when they were published. And I found this chart. It's a health spending projections chart. Health spending is a percent of GDP. And look, it goes all the way out to 2130. And in 2130, health spending is 100% of GDP. I thought, who wrote this stuff? Oh, it's extrapolate and a joke. Health spending goes over the cliff. Health Affairs 2000. I made this chart up. Come on, give me a break. Look, we're never going to spend 100% of GDP on healthcare. That's not where we're going. But we are at a place where the growth, we keep calling it unsustainable, but we keep doing it. So I just want to close by saying this. I'm prepared to embrace the idea that health is everyone's business. I think it's a good organizing slogan. Maybe you can think of a name for the campaign. But if we are serious, We have to share the agenda of others who we see as our allies. We can't just try to bring them into our agenda. And we have to share the power. We can't say, we need you now, but we're not really willing to invest in you in the long run as partners. We just need you because there's this new business model we're trying to figure out, and that we can't achieve it without your help, but we're not really willing to embrace you and the role you play. And given all of the excess in the healthcare sector, given all of the true waste of all forms marbled throughout that sector, we have to, as we ask others to do more, challenge ourselves to do more. Because my view is that in the end, the final element that's necessary to make this slogan more than a slogan is that to make health everyone's business, we have to share the money.